Okay. Closed captions are available for this program. If you need closed captions, please click the closed caption icon located on your Zoom screen. Hello, everyone. My name is Kerri Wallace, and I am the Circulation Supervisor and Outreach Librarian at the Ridgewood Public Library. On behalf of the Library Director, Nancy Green, and the Friends of the Ridgewood Public Library, thank you for joining today's MedlinePlus and Local Mental Health Resource Training. This virtual program and closed captions provided by Total Caption is funded through an award from the network of the National Library of Medicine Middle Atlantic region, a partner of the All of Us research program. The National Institutes of Health's All of Us research program aims to build one of the largest, most diverse collection of data of its kind for health research. The goal is to have 1 million or more diverse volunteers nationwide who will share information over time. The goal of the program is to also help researchers understand more about why people get sick or stay healthy. By looking for patterns, researchers may learn more about what affects people's health. To learn more about the All of Us research program, visit www.joinallofus.org/NLM. The library would also like to thank MedlinePlus. MedlinePlus is the home of consumer health information from the National Library of Medicine. Imagine MedlinePlus as your new health information Google. Health topics on important health issues like asthma, cancer, diabetes, etc., drug and supplement information, healthy recipes, videos, health quizzes, medical encyclopedias, searchable and browsable, clinical trial information, easy to read health information on various topics like mental health, a directory to find local health practitioners and organizations, information in over 45 languages, and most important, no advertisements or endorsements ever. So thank you again for coming to today's training. In addition to working at the Ridgewood Public Library, I'm also on the Village of Ridgewood Stigma-Free Committee. Back in the fall of 2020, the Stigma-Free Committee was concerned with winter approaching during the pandemic and how the cold weather may force people into lockdown again and to feel more isolated. These could have significant triggers for those with a mental illness and for those who may not know or haven't addressed a mental illness. With this grant that we were awarded, which we called Project Connect, Keeping Mentally Healthy During the Pandemic, our library was able to host programs to help residents cope with these new anxieties. And today I will be showing you how to use MedlinePlus. And as I mentioned earlier, is a sponsor of many of our initiatives. So let's get started. And I will be sharing my screen, and I'm going to not show my face. Also, apologies. When I sent the link, I sent it as a Toom link and not a Zoom link. So I think we're all tired of Zoom. So to get started, we're going to start with MedlinePlus. To access MedlinePlus, you visit medlineplus.gov. There are over 1,000 topics and 35,000 links on. Oh, hold on. My coworker Lori is here, and my screen sharing was paused. So let's restart. Sorry, everyone. Here we go. Does that look better? Hooray! All right. So again, it's medlineplus.gov. There are over 1,000 topics and 35,000 links on health resources. And before we start getting into the resources and into the training, I do want to point out that something MedlinePlus does is they have a disclaimer at the bottom of their page. And here on the disclaimer, it gives information on how they choose their links, and they also stress that you should consult with a physician on any of the information that you look up. Also at the bottom of the page is a guidelines for links. As mentioned before, MedlinePlus does not endorse or use advertisements on their website. So other medical websites that are more commercial, you might see ads, and that can be a little bit like clickbait, where someone might see an ad and go to that company or that product and not really follow up with the research on that. The outside links and references are evaluated by quality, authority, and accuracy of health content. The primary purpose is education, and again, not to sell a product or service. And they also make sure that the websites that are featured are reliable and maintained, so that they're updated yearly, or as close to yearly as possible. So we're gonna go back to the main page. All the information on MedlinePlus is at a 6th grade reading level or below, and it's also copyright free. So it's they try to make it as easy and comprehensible as possible for everyone to understand. On their main page, you'll see you can find ways to connect with them on social media and to share. They have a Twitter account. You can also sign up for their MedlinePlus newsletter to get information. And they also have articles that's featured in their MedlinePlus magazine. So let's get started and dive into using MedlinePlus. So the first thing that we're going to cover is the health topics. The way you can search for a health topic is there's 2 ways. The first is you can use the keyword search, which is located in the right-hand corner of the page. So we're going to type in a keyword. So we'll start with opioid. Make sure I can spell. Okay. And once you pull that topic up, you can refine your search. So you can refine it to a health topic. Maybe you want an encyclopedia article, etc. So if we click on health topics and we click on this top one, you can look at different other topics that are featured. And if you click on that link, it will bring you to the page on that information. The other way to search for health topics, and we'll go back to the main page, is by browsing. So you can get to the browsing features by clicking on health topics here, or by clicking on this image right here. You can find topics alphabetically by the first letter. You can also click on a list of all the topics and scroll through them. Or they also list categories. So if you are looking for topics on particular body location, if it's a disorder or condition, if you're looking for a specific population and demographic group, diagnosis and therapy, health and wellness. So we're gonna browse a topic, and we'll go to the fitness and exercise page. And we're gonna click on the article that says exercise and physical fitness. And we're just gonna go over this page. So the way someone can find the information is they can read the whole page from the summary to the very bottom where the resources are listed. Or maybe you come across this page and you're specifically looking for clinical trials or related issues. If you're looking to find an expert, you can click on any of these links and it will bring you down the bottom of the page to find that information. You'll also see there's a section called See, Play, and Learn, which will have health check tools, videos, and tutorials as well. So I'm going to click on, let's see, let's go back to the reference desk. What I would also like to show you is the links. When you're looking at these links, will show you where they got the information from. So if you click on Fitness All Guides, it will bring you to an outside link and will bring you to that article, which MedlinePlus has gone over and they made sure that it's appropriate for their website. You can also, you'll see too, there's some links that will keep you within the page. So sometimes that can get a little confusing. So if we click on this link, National Heart, Lung, and Blood Institute, whoops. Oh, this one actually brought us to the National Institute of Health. My apologies. So many of the resources will bring you to the National Institute of Health. And let's see if we click on this one. Are you getting too much exercise? Because there's an encyclopedia on MedlinePlus, you'll stay within the same page. Lori's going to help me with questions. Is there any questions that popped up? A technical question. Okay. All right. So let's go back. So just be careful. You know, some links will bring you to outside MedlinePlus, and then some stay within. So just be careful for those. Okay. So let's go back to the main page. Are there any questions about health topics or also on the side of the page, I forgot to mention, in addition to the topics within the topic, there's this, on the side, you'll have access to the encyclopedia. It will also show you related health topics. If the topic is available in other languages, which I will show you later, and any articles on this topic that was featured in their magazine. And again, you'll notice here, they also have that disclaimer and how they chose the links for this topic. Okay, so we're gonna go back to the main page. The other feature, topic and resource that they have, and it's a question that I say comes up a lot at our library, is information on drugs and supplements. The physician's desk reference guide for prescriptions does get asked a lot at our reference desk, and this is a good resource too. So you can, just like you did in a health topic, and you can search by keyword, and we'll type in Ritalin. And here is where you can refine by type to drugs and supplements. And here at the top is our first result. And you'll see though, because Ritalin is a brand name, what's going to pop up is the scientific or the generic name. Again, if we go back to the main page, you can also search for, you can browse drugs and supplements. You can click here at the top or on the side here. So here is where you can browse by the generic name or the brand name. Let me just go back to Ritalin to show you what that entry looks like. And I'm going to scroll down. Where is it? You can also use my favorite website feature, Control F, to search the page. Okay, so here you'll see at the brand name, it's recommending that you should also see the scientific name. So if we click on this. So the way the drug, prescription drugs and non-prescription drugs page looks like is you'll see these are the common questions that people might ask about this particular drug. So you can click on these questions to look for those answers. So we mentioned before, Ritalin is the brand name. You can click to see what other brand names it might also go by. And also you'll notice at the top, there's an important warning. Most, but not all, will have, if there is a warning by the FDA, the Food and Drug Administration, MedlinePlus will list it here at the top. And if we scroll down to the bottom, I also just wanted to show you that it'll tell you when it was last updated. So you can see if it's recent information. And it will also let you know if the product is still on the market. So in case maybe there was a medication that a person was taking, it might not be on the market anymore. So they might get a prescription under a different name. So they'll be able to see that information. And the prescriptions that are listed in this database are license protected, and it's from the American Society of Health Systems pharmacists. Okay, and now let's just go back to browse again. And I'm just gonna check in with Lori. She's helping me with the questions, but nothing's coming in.
The only thing that I would add is that patrons who are used to using WebMD would be able to navigate this pretty quickly because it does have similarities to WebMD. And when you're explaining it to patrons, the most important thing is to say that they don't accept ads. So you're really getting medical information without any kind of bias. So, but the interfaces are quite similar, I would think.
Yeah, and I think it's, as I said, it's at that 6th grade reading level as well. Right. So there's within the same article, there's dictionaries and there's an encyclopedia. So you can sort of stay all on the same database to get that information. So back to browsing with drugs and supplements. In addition to prescription medication, there's also a database for herbs and supplements, which you can browse. You'll also see on the side here, they list these are maybe the most common topics that are looked up and searched for this prescription for herbs. So let's click on all herbs and supplements. I always say herb, sorry.
Very British.
I'm very British. Okay, so for herbs and supplements, you can browse as always by the letter, and it's all in alphabetical order. Again, you'll see if it has this National Institute of Health little logo here, you'll see it by the acai. If you click on this, it's going to bring us to outside of the MedlinePlus website. And it's through the this page will give you background information. They will tell you the common names. It will also tell you what research the National Institute of Health has done or what is out there for people to know. It will give you information about the safety of the herb and supplement And also, I found this on many of the pages for this topic is there's always this talk to your health provider, which is a very important reminder. All right. Now there's other records that will keep you within MedlinePlus. So for example, if we scroll down to bee pollen, if we were to click on this, you don't see the National Institute of Health logo. You will see the Natural Medicines Comprehensive Database, and that's with MedlinePlus. So if we click on bee pollen, it looks very similar to the prescription database. These are the common questions that patrons might have, or consumer will have about this product. If you scroll down, it will give you information about how it's ineffective, if it's effective, maybe someone who's breastfeeding, they might not be the one to use it. And also if there's any interactions with your prescription medicine, which herbs and supplements can have. So if you scroll down, it'll tell you if it's possibly safe, when it's possibly unsafe, and as always, to consult your medical provider. Are we doing any questions or no? We're doing good. Well, thank you. Thank you, everyone, while still staying tuned as we move on. Let me just get to the next page. Okay. So, as I mentioned before, one of my favorite features about MedlinePlus, and this is really great for communities with population, their first language isn't English. MedlinePlus has topics available in other languages. The first part is you can switch from English to Spanish by clicking on the orange Espanol link here. And it's basically a mirror image of the English version of MedlinePlus. It has the same resources and databases as the English side, and it looks very similar with its images. So it will be easy to navigate if you need to help someone who's doesn't speak English. If we go back to the English side, you can also scroll to the bottom of the page. And there's a link here that's help information in multiple languages. So you can look, the languages are listed in alphabetical order. So you can scroll and let's click on German. And you'll get a list of all the articles that have been translated into German. And you'll notice too, it's a PDF document and it's available in English and German as well. So again, it'll be, if you're trying to help someone navigate the page, you'll be able to see the translated side as well. You can also, if we look for a topic, so let's say we're looking for information on COVID. If we click on health topic and we click on the article that we need, if you scroll down, there's this little box that says other languages. And if we click find health information in languages other than English on COVID-19, it'll show you all the languages that are available and how this topic has been translated. So it's really great if you have an ESL program, especially during this time, to have this information printed in their language. The other thing that I really like about this website is, I know for myself, sometimes if I'm going in for a medical test, I might be a little nervous. I don't know all what to expect before the test or after the test. They have a listing of different types of medical tests, which are, again, in alphabetical order. So if I were to click on the allergy skin test, it'll give me information about what to expect, why are they doing it, maybe the reasons why I think I might need an allergy test, and all the information, which might help someone be a little bit more at ease if they have to go for a medical test. And again, on the side, there's related health topics too. And last but not least, there's videos and tools. So you can search for different health videos. You can also browse them. So if we were to, let's browse for a health video, maybe on allergies, since it's allergy season. If we watch this video, you'll see there's also closed captions available too for that video, which they didn't pop up. There we go, they're popping up now. Okay, let's go back to the main page. And everyone, I know cooking is very popular, so if you're starting a diet, which again, always consult your medical practitioner and your doctor if you need to go on a diet, but they have lots of different healthy recipes. And even if you look up, maybe I was looking up high blood pressure before, in that topic, they link to the healthy recipe, and you'll see it's broken up by the type of meal that you're cooking. And also if you're trying to go dairy free, or you're looking for more snacks or low fat. So it's a very good website. It's easy to navigate. I've been using it a lot more these days because I feel like the ads that are on websites like WebMD, they can get overwhelming. And if you find yourself on that rabbit hole of clicking on different links, it may not bring you to the result that you need. So I highly recommend that you use MedlinePlus, play around with it, maybe put it on your website. I don't know, has anyone in the room ever used MedlinePlus or is familiar with it? Oh yes, I saw the health videos can be shared. We can go back to that. So let's go back to videos and tools. Let's click on them. Let's go with back to allergies. I think what you might have to do is share the link to the video. Although, yes. Yeah, I think what you would need to do is, also at the top, but you'll see the email and the Facebook to share, but it will still just bring you back to this page. I can get in touch with someone from MedlinePlus too to see if those can be shared as well. Thank you. Are there any other questions? Okay. All right. So, another. Oh, you're welcome, Laura. Okay, so that is MedlinePlus, and we're very grateful for their support of our programs during this time. MedlinePlus and All of Us Research program, as well as the National Network for Libraries, they helped us put programs together like virtual meditation, bereavement, and we also had a really great author program called Getting It Done When You're Depressed, which you can access on our YouTube channel. We also, if you're on, follow us on Facebook, I recently did a video on ebooks that we were able to purchase from the grant, and they're all on mental health topics, and you can borrow those from Libby and Overdrive. Okay, so the next thing that I'm going to show you is our mental health brochure. To access the mental health brochure, you can visit our website, www.ridgewoodlibrary.org. You're going to click on services. And temporarily, the brochure is located under COVID vaccine and info. And if you scroll down and click on emotional support, the brochure is located at the top of the page. You'll notice it looks a little interesting, as one page is landscape and the other is portrait orientation. I did this in the hope that someone, if they use it, if they need this, they can maybe post this on their bulletin board or their fridge. And we're hoping down the line to possibly turn it into a magnet. If you click on the printer-friendly version of the brochure, they're both in the same orientation to make it easy to print. This template that I created, I made on Canva. So if you would like to make something similar for your library or just to have in general, and you would like the template, please email me and I'm happy to share. My email is kwallace, WALLACE, @ridgewoodlibrary.org. Okay, so here is, so we're going to start with the inside page. So the goal of the, whoops, and I did not bring up the inside page. The goal of this brochure was to list these numbers in order of how they would be used first, from emergency to down the line of more support services and resources. With any medical emergency, if you or someone else is in danger of harming themselves or others, call 911. That is there for you. There's no shame in calling 911 if you don't feel like it's mental health emergencies are real, and you should feel comfortable with using that if you need to. If the other emergency number that's very important, and we've used it here at the library, is the Bergen Psychiatric Emergency, which is a psychiatric emergency screening program. And many of the emergency services in Ridgewood, if it's a mental health crisis, will call the Bergen Psychiatric Emergency number. What they'll do is they will provide an evaluation and crisis intervention. They also have a children's mobile unit, which will include a safety assessment. And from there, they will analyze the situation. Maybe the person in need of help might need to go to the hospital, or maybe they need outpatient services. They will be able to assess and provide the right information. Many of these resources that are listed, you might be familiar with, so I will only highlight a few to go through, because there's a lot, and we don't have a lot of time to go over. We will be a couple days maybe. So everyone's very familiar with the National Suicide Prevention Lifeline. Their website, and especially now, there's so many resources that are available online virtually with the pandemic. While there is a phone number for the National Suicide Prevention Lifeline, you can also access their website to chat. They provide information in Spanish, and they also have accessibility features for those who are deaf and hard of hearing. The website includes information for attempt survivors, youth, LGBTQ+, Native Americans, and those who have lost someone or survived a disaster. You'll also, on this PDF on our website, the phone numbers are listed, but there are links that you can click on and they will bring you to that website. The National Suicide Prevention Lifeline has resources for youth, but there's also a source similar to just focused for youth, and that's called Second Floor, and that's for ages 10 to 24. So someone who's in that age range might feel more comfortable calling Second Floor. They might be nervous calling the National Suicide Prevention Lifeline. On this website, they have resources similar to the National Suicide Prevention Lifeline. They have articles, forums, and resources on bullying, mental health, dating abuse, substance abuse, and sex and sexuality. In addition to calling this number, you can also text it too. As I know, calling someone on the phone, especially if someone has anxiety, is intimidating. So nowadays, emailing or using the chat feature or text might be a little bit more comfortable. So after these emergency hotlines and phone numbers, there's also directories out there. My first recommendation for directory to use is New Jersey 211. And that's another line that you can call. Just call 211 and you can speak to someone and they will make referrals for you and help you find the resources that you need. You can also use their website, which has a chat feature and lots of different resources and information. You can browse topics like basic needs. If you find housing or a shower or clothes, there's emergency preparedness, family matters, hard times, and they also list volunteer opportunities. New Jersey 211 was spearheaded by United Ways of New Jersey and is now a nationwide resource. Bergen ResourceNet is maintained by Bergen Promise, and they serve children and youth ages 5 to 21 and also families. Their focus is on behavioral, mental, and emotional health challenges, as well as substance abuse and developmental disabilities. In addition to resources, they also list events and webinars. I was able to promote some of the mental health programs we had at our library on their calendar. And it's a very good resource that I would recommend if you add it to your website or just you can use it to promote your programs. There's also the directories from the New Jersey State and Bergen County offices. However, they're PDFs, so it's a little hard sometimes to navigate. Where 211, you can do keyword searches. As a PDF, you can see it's taking a long time to load. And while you can click on some links, it's mostly a lot of scrolling. However, you can always call these offices and they will be able to get those resources for you. Okay. So these referrals, after, if you do your own research on the directories, or if you were put in touch with the psychiatric screening, they might make recommendations for mental health facilities, whether it's inpatient or outpatient. Some of these you might be familiar with. The hospitals are going to be inpatient services, although they do, after you leave inpatient, will refer you to outpatient services. One of the ones that I wanted to highlight on here is the CBH Care Wellness and Support Center, and that's through Comprehensive Behavioral Health Care. CBH Care Wellness and Support Center is almost like an urgent care for mental health illnesses. So if someone is having a crisis, they can go to this urgent care to meet with someone. If they need to be put on a prescription, they have a pharmacy. It's a good place if maybe someone's doctor is out of town and they need, they're in a crisis, or if you're in between therapists and psychiatrists. It's a very good resource, and they're located in Westwood, New Jersey. Their pharmacy is located in Hackensack, but it's just a good source to have. Christian Healthcare Center is very well known. They do have a background in religion. However, they also offer inpatient and outpatient services. They really have really good resources. They're very well known. And again, it's up to the patient, it's up to the person who needs help to find out what's best for them. So if Christian Healthcare Center isn't what they're looking for, there's other options, even from CarePlus New Jersey or West Bergen Mental Health Care. West Bergen Mental Health Care is in Ridgewood. They also have a facility in Ramsey for youth, and we partner with them a lot. They've done great programs for the community, and they're just a wonderful resource here in Ridgewood. Okay. So as I mentioned before, a lot of during the pandemic, many of the resources went online. There were a lot of telehealth, there were a lot of virtual programs to offer support for those that need it. Many people may be familiar with the National Alliance on Mental Illness. It's also called NAMI. They're offering Zoom programs for families and individuals to meet in a support group environment, and it's anonymous, and they're very careful with who goes into it. In addition to NAMI, another one that I recommend and I'm familiar with is the Depression and Bipolar Support Alliance in New Jersey. They used to meet in Hackensack, but many of their programs are online. And I believe what they're finding is that because it's online, it feels more anonymous, that people are being more open. There's still that isolation, but they're still finding ways to connect. The other site on here, Collaborative Support Programs of New Jersey. Those are peer-to-peer volunteers, and they help those adults with behavioral and also substance abuse histories. And it's volunteer run, and they offer, whether it's helping people get back on their feet, looking for a job, finding housing. It's a good resource here in New Jersey. And then the other one I wanted to feature that's listed on here is New Jersey Mental Health Cares. New Jersey Mental Health Cares has an online screening, and they'll also make referrals. So after you do your online screening, they can help you find the support that you need. And also after your screening, if you do find a medical professional that you need, you can bring those results with you. The other ones I think everyone is familiar with. However, if there's something you would like to get more information on, you can always click on the link, or you can send me an email. I'm happy to go further on these topics with you. For this brochure, because the numbers changed, I called all the organizations to make sure the phone numbers were correct, and they were very happy to talk about the resources that they offer. I'm going to go to the front of the page. So again, I've already talked about second floor. Perform Care is one that you should know about. They also coordinate and make referrals for children. They help with parents and also teachers who may need that assistance in order to get a child or teenager the help that they need. Some people, I think the question that may come up is, what if people don't have health care? There's resources for those that may not have insurance, and people can talk to the organization and let them know what their situation is. And what I found is, if let's say Vantage Health System isn't what will work for me, they will help you and make referrals to maybe another organization that will. Other financial resources, Bergen County United Way, they're the ones who developed the 211 resource. They provide housing and help with rentals. They also have a fund to help people get back on their feet. So we have lots of great resources here in New Jersey to help with mental illnesses and to help people who are just having a hard time emotionally, especially during this past year. And the last thing I do want to, and I encourage everyone, is to, get to know the people in your town. We have really great partnerships with Age-Friendly Ridgewood and our emergency services. Everyone that we've worked with that are partners with us have been trained in mental health first aid. Many of the staff here at the library has been trained in mental health first aid. So it's a good course to take in case you do encounter a crisis, not just with maybe someone you work with, but it could be a family or a friend who may need some assistance. So I hope this brochure was helpful. I hope the MedlinePlus is a site you will refer to. I thank everyone for coming today, and also a huge thank you to our closed captioner from Total Captions. Thank you, Lauren. If there's any questions, feel free to ask, and I'll show my face again. I want to say also, just to end, please look at your communities to see if there is a stigma-free committee. I just think that it's a really good partnership to connect with the stigma-free committee. You make connections with these resources that were listed on the brochure, and it's just during hard times to know the information that's out there. Well, I don't see any oranges. Again, if you have any questions, if you would like a copy of the brochure, you can print it on our website. If you would like to create something similar, feel free to email me. My email is K Wallace, WALLACE @ridgewoodlibrary.org. All right. Well, thank you everyone for coming. Phew. All right. Oh, I see. Oh, Laura had something pop up. Sorry, I missed it. CHCC has multiple staff members on the flow. Franklin Lakes, Oakland, Wyckoff, and Stigma Free Committee. That's awesome. Christian Healthcare. Oh. There's a lot of abbreviations. Yeah, that's on our Stigma Free Committee. We have members from West Bergen. We also have from Newbridge Landing. Yes, and again, it's not strictly denominational. They do. It's open for anyone to go to. You don't have to be religious in order to use Christian healthcare. Well, thank you, everyone. Have a good day.
Bye.
Bye. Lori says bye. Thank you, Lauren.